everybody. This is Essay Fure, and I'm so excited today. We have two special guests here for Inspire Magazine representing One Accord Health. And they're here to discuss a couple of things about the initiative that One Accord has going on. And we're really excited to talk about that. So please introduce yourselves to our audience.
Hi, my name is Lolita Melhado, and I am a nurse practitioner, but I also have my PhD in nursing, and that's in the area of palliative care. I am the vice president for the clinical programs at One Accord Health.
Awesome.
Hi, and I'm excited to be here as well. My name is Jim Farnham, and I'm the president of One Accord Health. I handle the business aspects of what we do, sales, marketing, and operations.
Awesome. Very excited to have you both here. And just so our audience could know, I have a little bit of info about One Accord Health. One Accord Health exists to ensure healthcare professionals and stakeholders engage in discussing around identifying and articulating patients' values, goals, and preferences when it matters the most. Sensitive and thoughtful discussions early in the disease process can empower and guide patients and their loved ones during end of life and the moment decision making. So for me, what that says for me is, my own personal experience, I am a caregiver to my parents. Sometimes when you are in charge of taking care of your parents, there's just certain things that you just have to make sure are set and are in place. So that's why I felt this type of conversation could be very important for those people. Whether you're younger or you're older, there's always going to be somebody that we're going to have to take care of. And we want to make sure that when it gets to that point, that certain things are in structure and in place for them. All right. That sounds about right?
Yeah, you actually did a good job summing that up. Yeah.
Listen, it comes from experience. And, that's always the best place to engage others is from your own personal experience. And again, I know the difficulty that can be had. So this to me is very important. And it's something that a lot of people should know about. So
It's pronounced palliative care, and palliate means to alleviate the symptoms. And so palliative is just the expression of what that care encompasses. And it really is, when you think about it, it's really, I call it holistic care because it's mind, body, and spirit. So we meet people where they're at the time they get their serious illness, and we help walk them through that journey. If they need psychological support, social worker would provide that. If they need spiritual support, we have a chaplain that would provide that services. And if they have physical needs, then I would help to provide and alleviate those symptoms, whether it's, pain or any kind of, shortness of breath, any type of symptoms that they may be having.
Okay, thank you. Jim, would you like to chime in on that, or are we good with the definition and the explanation?
I think she nailed it. So,
all right, thank you, and hopefully I'll get the pronunciation correct going forward. When does a family need to consider this type of situation or this type of care for their loved ones?
Okay. So at the time that a person gets their serious illness, their diagnosis, whether it's cancer or any kind of, lung problems or pulmonary problems, heart problems, it's a good idea to engage in palliative care because it really is holistic care. Right now, our former president, President Carter, is under hospice care, which is something different. But palliative care is at the time you get that diagnosis to help provide either that symptom management or even to have the conversations around advanced care planning. Because oftentimes, a person comes into the hospital and they're very sick, they're having these symptoms, and that's the time that the physician will engage them in having a conversation about advanced care planning, and the person has no idea why we're having this conversation with them. So early on, we have an opportunity to learn about their values, what's important to them, who is the family, and what kind of support do they need, so that we're there partnering with them, helping them as they take that journey.
How important is it to make sure that you're engaging the family? And have you ever noticed that it can be difficult to partner up with the family at this part in the care?
it's important to engage with the family because, especially in the African American Black communities, where sometimes family is who you say it is, right? It's
Mhm.
my auntie, it's the person who, was my, next door neighbor that helped to raise me. And it's important to kind of identify who these people are so that you can begin that dialogue about what's important and basically understanding what is that person's wishes and their preferences, right? Because what you want to do is you want to align them, the patient, the family, everybody on the same page. And by the way, that's why we call ourselves One Accord, because we really want to help align people so that they know what is ahead in terms of what their illness is and what kind of treatments are available and what their wishes are so that everybody can be on the same page.
Awesome.
I do want to add, we've been really kind of identifying the seriously ill patient. But one thing that this pandemic has taught us is that, death can strike pretty much at any time.
Mhm.
And we truly believe that an advanced care plan, that everyone should have it. Whether you're seriously ill or just planning for the future, for the inevitable, we're all going to die. So because of that, we really do want to educate the community. And I'll give you an example. So I had recently a cousin of ours that passed away unexpectedly, 48 years old, in the prime of her life. And come to find out, she did not have an advanced care plan. And so us as a family right now, we're still trying to figure out, unravel all the things that need to be really considered and done at end of life because she didn't have her affairs in order.
Yeah. And that's something that we I feel like either we wait to the last minute to do for some reason, and I don't know what it is, but even in my culture, and I'm Nigerian, it literally is like we should not be waiting until a week or two when the person has already passed before we're trying to figure out what's supposed to go on. So I think that's very important. With you having the name One Accord, wanting to bring this information to our community and to those who really need this information so we don't have to keep going through this cycle over and over again. So definitely thank you both for mentioning that. How does palliative care help the patient as well as the family?
Well, one of the things that we do is we try to find out what are the needs, right? What is the most pressing needs? And sometimes, the need might be, I don't have money to buy food, or I don't know, where I'm going to get medicine, where I'm going to get money to pay for my medications. And so we also, with palliative care, especially around the family, they have a lot of anxiety around, well, what's going to happen to my loved one? And so we can provide that support, that psychological support, the emotional support to the family as well as to the patient. And we try to connect them with the resources that are available in the community so that they can get that medicine or so that they can get the food that they need.
Okay, thank you. And you spoke to, families do get anxiety when they're in this stage. Does when you hear palliative care, does that mean your loved one or whoever is involved in this is near death? Is that usually the first thing that people think of when they hear this?
Well, for so long, hospice, the word hospice and palliative care were connected. And, typically hospice is care that you get when you have 6 months or less to live. But because palliative care has been connected with it, people only got palliative care when they were at end of life. But because of technology, people are living longer. They have multiple comorbidities or multiple, chronic illnesses that are causing symptoms, and they're in and out of the hospital, and they're not at end of life, but they need palliative care. They need some of those same services that people who were at end of life was getting. And so I think that there's a lot of education that needs to be given in the communities around what palliative care is because of that misconception.
I definitely agree. Thank you. Definitely agree.
Yeah.
Um, I know you've mentioned a couple of things like helping people get their medicine. What are some essential components of palliative care?
So again, I said it was mind, body, and spirit. So with palliative care, you want to first make sure that you're addressing the physical needs. So if there's any symptoms, distressing symptoms that may not be alleviated. So for example, a person who has cancer, who's on chemotherapy, they may be having side effects from the chemotherapy. And so sometimes those side effects are not addressed by the oncologist. But with palliative care, we come in and we try to make sure that we're alleviating those symptoms so that the patient can have improved quality of life. So that's around the physical. Around the spiritual, sometimes people are in distress. Why me? Why is this happening to me? And they're angry. And so just getting them that, first of all, asking them, do they have a pastor? Do they have someone they would like to talk to? And if they don't, then making the recommendation and then making, facilitating that by getting the chaplain or someone to come and talk with them to alleviate that distress. And the same thing around the psychological or the emotional, having a social worker, just somebody to talk to. Sometimes people just want to be able to be heard. So just being able to listen to what they have to say.
Wow. I mean, those are such important points because, again, it's so much more than the actual diagnosis of what it is that this person is dealing with and what is the medical plan for this person when, like you said, it's other components to that. And I want to kind of talk a little bit about that because usually there's some people out there when they get a certain diagnosis from the doctor and the doctor gives them their outline treatment. Oh, I'm going to go look for holistic healing. So when you say palliative care is holistic healing, why do you think people kind of separate the two? And what do you think makes them both similar?
Well, with palliative care, sometimes we do offer the non-conventional approach to that care because we never tell a person don't take the vitamins or don't seek that alternative treatment. If it's going to improve their quality of life, then we're that's one of the things that we try to encourage. And I'm not sure why it got separated. Only this is just kind of my take on it, because it does require specialized training. Like I said, when I started in this field, I had a master's degree. I was just, I was a nurse practitioner, and I felt like there was something more to palliative care. So that's what led me to go back for my PhD. But what I found out was that we have separated, I think, in medicine, we have separated the conventional treatment from this sort of holistic approach, which is the communication, the listening, the getting to know the person, because it takes time. And so it's a whole subspecialty because it requires time, And so usually when I go to see a patient, if I'm there for 2 hours, I'm there because I'm getting to know that person and that person is getting to know me. And, and again, I'm addressing whatever their needs are. And there's always follow up with that. So.
Oh, it's very important. I'm glad you broke that down so people could understand these when you go to the hospital, when you're waiting on a nurse, you're waiting on a doctor. These are the things that you have to kind of consider or think about. Does this person really care about me? Are they taking their time to not just, explain my diagnosis, but kind of understand my lifestyle? Maybe kind of talk to me a little bit to merge the two to, make me feel human, like I'm actually talking to a person as opposed to, granted, you are a professional, you went to school, you got all your accolades, but there's still like a human connection that you have to have with your patients.
Exactly.
I love that. Thank you so much. Maybe Jim can answer this question. Can you talk about this new partnership with AdVault and how this can help people during the sensitive time when they're going through this?
Yeah, I'm excited about this partnership with AdVault because it really means that we're going to be able to engage in these goals of care conversations, document it, share it with our loved ones and stakeholders, store it in the cloud, and then retrieve it when it matters most. One of the problems with an advanced care plan is that if, God forbid, someone shows up in the ER room and they want to know what your personal wishes are, you don't have the plan on you. We have this digital platform that allows it to be networked and is also through interoperability is connected with about 80 to 90% of the hospitals across the country. So if you come into the ER room and you can't speak for yourself, they can still pull up your plan and know exactly what you want.
Wow. I mean, I thought that was kind of already available by now. What was it that with what One Accord is doing that you said, okay, we got to make sure this is something that we make sure we make sure that our patients are going to have this opportunity again to have, if they are not in the city or the state that they're usually in and they're in another city or state and something happens, that they'll be able to have their documentation there for them. What was it that made you say, okay, this is what we have to have at One Accord?
So, and Lolita could probably answer and chime in on this, is because of her experience in working in the hospital environment. I'm sure she saw patients come into the ER room or into the hospital and their plans, they don't have their plans. They're somewhere in the vault. The healthcare surrogate may have it, but they're not at the hospital at the time. And so one of the things that we feel kind of passionate about is that you need to have the plan show up when it's needed most, and that's in the ER environment. And that the thing that attracted us to AdVault is the fact that interoperability, that the network with about 80% of the hospitals and hospital systems in the country.
Yeah, and I would just say that from my experience in working in the hospital, that I live in Florida, and so everybody comes to Florida in the wintertime, and they're usually the sickest, and they end up in the hospital, and they don't really want a whole lot of treatment. They just, some of them, they know that they have a terminal disease such as cancer, and they just want to come to the Florida to get some sun. But when they're here, they develop symptoms, but they don't have their advanced directives with them or their advanced care plan with them. So, I like the idea that the company that we have partnered with has a solution to that. And so, and the other thing too, is that working in the hospitals, I realized that African Americans, Blacks, did not know what advanced care planning was. And so I think one of the things that makes our service so unique is that we're providing this one-on-one opportunity to not only educate them, but to help them to complete their advanced care plan.
Oh, very awesome. I'm wondering when you guys started this and okay, this is what we're gonna do. It sounds like, did you have in mind to impact a specific audience? And when you did have in mind to, the first thing to me sounds like we gotta educate first. How did you feel you were going to be able to educate people on what you're doing? Like what ways, like we have our family, you have your family, you could tell your family, but what other ways were you seeing as One Accord can, people can know more about this so they can be educated?
I'll take a stab at that. So when we initially launched the company, we had in mind that we were going to train the trainer. So we were focused on educating the nurses and the doctors and those individuals that were having those goals of care conversations with the patients. And so we developed sort of consultant services where we evaluate their practice, how they're handling advanced care planning and palliative care, and educate them, train them, consult on that. We also developed a suite of online continuing ed courses for nurses. So they can go online. There's some canned programs, if you will, about palliative care and about advanced care planning that they can take for CE credit. But one of the things we realized is that the challenge with advanced care planning is twofold. One, most of the practitioners don't have the time and the skill set. It's very difficult to get into these goals of care conversations, especially when you got 5, 6, 7, 10 patients in a day to see. You really can't give the time necessary to really flesh out and these conversations appropriately. So because we felt passionate about the work that we do, we launched this individual concierge service where individuals, we can take the time we need to really walk them through the process, the document, store, share, and then retrieve these plans when it's needed most.
Wow. I mean, that makes all types of sense because see, originally I thought, okay, maybe we're gonna get the patients first, but no, we got to get the nurses and the doctors first because that's the first line of defense in the first place to even educate these patients before because they're gonna be at the hospital. So that makes entirely all types of sense. And again, this goes to the testament of how hard this job is. If you're working in a hospital, again, you're a human being treating another human being. You got to make sure that what you're doing is going to keep them alive or do them well on top of their mental, and actually having a conversation with them and informing them of, okay, this and this and that. It's not like a quick, and I think that's something that I don't know. I think the pandemic maybe kind of shifted for a lot of care and a lot of nurses and doctors is the time that you're able to spend with your patient. Did that pretty much kind of also affect the decision of the plan for One Accord?
I would say yes. The pandemic has taught us that really all bets are off, that everybody needs to have a plan. And we know from our conversations with individuals that it's important, but it's just not a priority. So we set out to make sure that we're making it easier for them to do it. So we're going to walk them through the process, hold their hand, if you will, and educate them. And then make sure that at the end of that conversation, they walk away with a plan that they can, that's available when it's needed most.
Wow. I mean, that's perfect right there. And, again, I'm taking this interview twofold. One, coming from someone who has experience in taking care of their, one of their parents, where I'm like, okay, I'm already kind of like up to this information just because I've been dealing with it for quite some time. But when I first started dealing with it, I didn't know any of this. So this is the reassurance for people like me. I'm like, okay, it's a lot of work and I wouldn't want anybody else to go through this. I want to make, I would hope that other people do definitely take some time to get their affairs in order, have conversations with your aunties, your uncles, your whoever, and have this conversation. And on the flip side, it assures me that this is available to those people now going forward. So I'm definitely hoping that this information will get out there and, we can close this out with, a final word that you both may have in regards to, the impact that you see One Accord having on our community and and everyone else in general.
I'll go and then I'll let Lolita close it out. We believe the most loving thing that you can do is let your loved ones know what your personal wishes are, because that's going to alleviate the decision-making burden at end of life during a crisis. So instead of trying to figure out what your loved one wants, you would be invited to help them execute on their plan. And that's a whole different feeling and mindset as opposed to trying to figure out what they wanted. They're going to solicit you in carrying out their wishes. And I think that's a better position for us to be in, frankly.
Yeah, and I totally agree. I also think that this is how we close that health equity gap. People should not have to show up into the hospital when they're sick and, have dialogues around, and especially when the providers, the physicians or the nurses don't have time to engage in this, but, to have to make a decision right now. And so I think that, we just like we plan for weddings, we plan for birthdays and other occasions. I think that we need to, be prepared, and be prepared so that we don't have to scramble and, have other people try to figure out what it is that we want, that we need. So, yeah.
Awesome. Listen, Jim and Lolita, I really appreciate this conversation. I think it's very important. I'm definitely so interested in following up with both of you, and we can continue this conversation because there's so many aspects of this that I'm sure we didn't even touch upon, regarding resources, regarding availability, just regarding what simple steps can people do to be comfortable in having this conversation. Because again, it's not one that we have too often. And I definitely have that personal experience of that. And again, this was a very enlightening conversation for me, and I hope it was for our audience. It was definitely a pleasure, Lolita and Jim, and we're looking forward to seeing the great things with One Accord. And, our Inspire audience, please, make sure you check out the information that we're going to be having on our website regarding One Accord Health. And, all you can do is share that information. That's where we're going to start. We're going to make sure that we share this to make sure that everybody knows that this is there for them, whether you're 20, 30, 40, 50, 60, 70, 80, 90, 99. This is still imperative advice in this conversation that we've had. So I'm going to close it out. Again, thank you so much, Jim and Lolita of One Accord Health. Inspire family, appreciate you.
Thank you.